Welcome back to This is VANCOLOUR. Back in March 2024, British Columbia was the first province in Canada to establish minimum nurse-to-patient ratios. Basically, the minimum number of nurses needed to look after the number of patients in any given unit. This is to improve working conditions for nurses and health outcomes for patients. But are those ratios even being implemented? Here to discuss, the president of the BC Nurses Union, Adriane here. Adriane, so nice to see you. Thanks so much for being here tonight.
Thank you for having me.
So I think most people can understand this idea of nurse to patient ratios. If you have 10 patients in a certain unit, the minimum number of nurses needed to look after those patients. I guess I'm curious, where does that ratio number come from? Who determines it?
Oh, well, great question. Certainly, BC isn't the first jurisdiction in the world. It's the first jurisdiction in Canada to establish ratios. And so when we were negotiating what the actual ratios will be, we certainly looked at, evidence. We looked at research. We looked at other jurisdictions. Certainly as nurses, we have practice standards, and patients, for different patient populations, there's clinical practice standards. And so they weren't numbers that we just pulled out of the air, really built on, frankly, some really good work that had been done before us. Where we are unique is ratios in time in phase 3 will also apply to community non-hospital settings and long-term care. We will be charting that course. We will be the first in the world to establish ratios in those areas. In terms of the acute care ratios, we've negotiated most of them. And again, it was very thoughtful and worked really hard with government and the health authorities to determine what is a safe ratio, not only for nurses, but also, as you said, what is going to give patients the best health outcomes.
Mm-hmm. Now, I feel like we don't even have to go too far past the headline to see these stories about severe burnout that nurses face, the safety risks that a lot of nurses face in different departments across the province. From my understanding, these ratios also help with safety of nurses, right?
Yeah. So again, based on, there's global research on this. And we know that when there's enough nurses to provide the care that patients require and deserve, you do see improvements, for example, in reduced violence. In California, they were able to reduce the incidence of occupational illness and injury by 32% once they had ratios implemented. So huge benefits for nurses. It reduces burnout rates. It reduces turnover. Just being able to feel good about the care that you're delivering keeps nurses in the profession. And then, of course, for patients, what we see is reduced length of stay, reduced readmission rates. And here's the real takeaway. A reduction in the 30-day mortality rate, which means a reduction in preventable deaths.
Wow.
And so this is great for nurses, but I can tell you this is the best thing for British Columbians.
So all of this sounds great. Good for nurses, good for patients. But when it comes to BC hospitals, how far along are we in terms of progress for implementing these ratios? Because, this was negotiated in 2023, announced in 2024. We're almost at the end of 2025 now. Right. So where are we at?
Well, are we going fast enough? 100% we're not. However, we are making some progress. And I do want to flag that other jurisdictions such as Australia, and they have ratios, it took them almost 10 years to completely implement.
Okay.
And so, we're at year 2. Are we far along or where I would like to see things? No, but have we made some good starts? Yes. And so we've divided sort of implementation up into 3 phases. And so we are currently in phase 1. And so an example of a phase 1 area that we are implementing ratios would be on medical surgical units. That ratio is 1 nurse to a maximum of 4 patients. There's some other areas that we're currently implementing. Intensive care would be another example. Basically, we have upward of about 400 care environments that we are starting to activate or implement. And so in terms of where we're at, we're only at about 35% to 40% of those units being activated, but it's a start. And, in terms of challenges, at the end of the day, this is something that is going to bring nurses to this province. This is a safe care model that will retain nurses. but we're still short nurses. And so it is going to be a bit of an uphill battle. We currently still need to recruit many, many more nurses and retain the nurses we have in British Columbia.
So is that the main limitation of really getting these ratios implemented, just the number of nurses that are working in BC?
The number of nurses, and I have to acknowledge that, the government and health authorities are experiencing some significant financial challenges. And ratios can actually save money once properly implemented. But certainly, we're sensitive to the fact that, yes, this does cost money. Our deal was funded over 3 years with $750 million. So there is money to hire, recruit additional nurses. And we just need to roll up our sleeves and keep it going.
What recourse does your union or the nurses in general have if the progress is too slow, if we're not seeing these implemented across the board in BC hospitals?
Right. Well, I have to tell you, many of my members ask that same question. Like, what's the stick? What's the stick if we're not at ratio? And this is what I have to tell them. We would never have gotten this deal if there was a stick right out the bat. We know on any given day, we have between 5,000 and 6,000 nursing vacancies. Mm-hmm. So we actually have to recruit and retain enough nurses to fulfill ratios. Then we can start talking about, what is sort of that compliance look like.
Okay.
I think for now, the government has publicly committed this, not only to my 55,000 members, but they've made this commitment to all British Columbians to transform the healthcare system, to ensure that when you need care, you're going to get the appropriate care that you need. Mm-hmm. Currently, when nurses and patients are not in ratio, there are negative health outcomes.
Right.
And so I want to say that I think in terms of, compliance around this, it's the public that really needs to hold government and health authorities to their commitment of minimum nurse-patient ratios.
For sure. Now, it affects us, obviously.
Yeah.
Really quickly, in about a minute or so, you do have upcoming contract negotiations coming up with the province. How much of this will be an issue, or is this a matter of it's already settled, it's just a matter of implementation?
Well, certainly, my members are looking for something, some kind of penalty or premium or something around ratios. So I know that is a desire of the membership. The way I'm approaching this is that for us to be successful, we need to have a competitive collective agreement. We need to stand out from the rest of the provinces. We need to ensure that there are agreements that improve our health and safety in the workplace. Unfortunately, the conditions of work on many units are very poor. And so I think there's things that we need to negotiate. We need to have employers held accountable to ensuring nurses' safety and to make sure that the practice environments are one in which nurses want to stay and want to come to. And so I think there's lots that we can do in terms of negotiations. I know benefits are extremely important to my members. And so certainly ensuring that nurses have appropriate benefits is something that we would be looking for in contract negotiations.
Well, Adriane, I think a lot of people in the province will be supporting your union in the upcoming negotiations. Good luck. And thank you so much for your time tonight.
And thank you so much for having me.
Oh, absolutely. Folks, that was the president of the BC Nurses Union, Adriane Gear. Now, after some business, we all know about long healthcare wait times in BC, but if those delays actually harm your health, can you sue the government? Kyla's court has the verdict up next.